Hi, and welcome back to Not Here to Fix You, the podcast where we talk about food, behavior, emotions, healing, and everything in between. I'm your co host, Amanda, food behavior stability strategist. I help high functioning women to eat consistently, especially under stress. With me today is Lazina, my co host, an emotional repair guide, and she is the creator of the relationship repair language. And we have a special guest today, which is Vanessa Connolly, who is a registered kidney dietitian and who works with CKD patients primarily. So I'm going to let Vanessa give a bit of a background and then we can jump right into the episode.
Hello, I am Vanessa Connolly. I am a board certified specialist in kidney nutrition, like kidney dietitian. I have been a kidney dietitian well over 20 years. And so I first started working in dialysis, and that's how I was kind of really exposed to just the diet culture just within that CKD population and how it's very, very, very restrictive. And if you don't know better, then you can't do better, right? And so as the years progressed, I realized there's a lot of folks that were not had the opportunity to be told that nutrition can help with slowing down their CKD progression. And so I truly believe there's a lot of folks who could have either prevented or maybe delayed dialysis had they worked with a dietitian prior to dialysis. And so just being in that space really kind of opened my eyes about how we can really have more of a preventative side with the CKD population, like pre-dialysis population, to really help with slowing down a CKD progression and complications. And so from there, I opened up my own private practice, and so I'm here to help folks really and support them in their CKD journey so they feel more empowered to be able to make those choices on their own and learn how to kind of interpret their labs moving forward so they can actually help themselves better at better supporting their kidney function. So I may not know people personally, but when I'm out there talking on social media, like I truly do want the best for you and I really want the best for your kidneys.
I wanna say really quickly, I didn't know about this, and a couple years ago, my stepdad, he passed away, but he's been in dialysis for over 15 years, and he had lost his kidney, then he had gotten another one, and then eventually he just kinda deteriorated, and I guess the information is just not readily available, you have to go and seek it, so I didn't even know about all of this, so I'm so excited to hear what more I'm gonna learn today.
Well, I'm excited to have you on the show, Vanessa, because for those who don't know, I have been following Vanessa for a few years and we actually met because we kind of joined group together. And I am not a CKD patient to the best of my knowledge, but following your content has really helped me to be more aware. I believe in prevention is better than cure, but I also am a big believer in management if you do have the condition. And we both have dealt with diet culture, but in different spaces. So I was excited to have you on the show and have your take on CKD because I remember I had this conversation with Vanessa maybe a year ago. And I said, hey, so are your clients primarily like older people? Because I always thought CKD happens to like the older ones. And she was like, no, I have, you know, clients from different backgrounds and different age groups. So I was like, okay. And then when I went to search it up, I realized that CKD is actually like a silent killer disease. And I was like, oh my God, that is crazy. So I think what I want to kick us off with is in your 20 years of experience working in this field, what is it that you've seen that most people don't understand about CKD? And what are CKD patients primarily going through on a day-to-day basis?
So I definitely want to say I personally do not have CKD, right? So I'm not walking in that lived experience. But what I can share is just me working with hundreds, thousands of CKD clients, pre-dialysis, dialysis. And so, yes, you're right that CKD is it's a silent disease and it's not just targeted to like older people. You know, you have a wide spectrum of different types of kidney diseases. There is like inherited kidney disease, there is autoimmune kidney diseases, and then there's kidney disease from underlying causes. The biggest one is diabetes and high blood pressure or hypertension. And so I have worked with so many people who have been truly walking around with kidney disease and not aware that they had kidney disease. And it wasn't until just like a routine annual checkup with their primary care doctor, and they might have noticed, like, hey, your GFR, which is what measures your kidney function, was low. So the the lab doesn't flag the GFR as abnormal until it falls below 60. There's different stages of CKD. And so when a normal GFR is greater than 90. Between 90 and a 60, this is where you can start having issues with kidney function. It doesn't necessarily mean it's chronic kidney disease. It could be some other issues going on that could be easily fixable. However, by the time somebody really finds out that they do have CKD, you're most likely going to be in a stage 3 or stage 4. There's 5 stages of CKD, right? Stage 5 is like your very late stage, and then you're teetering on that edge of end stage renal disease where you are needing some kind of renal replacement, kidney replacement therapy, whether it's dialysis or transplant, to be able to sustain life. So a lot of people do end up finding out that way. I've worked with people who had it on their diagnosis, like they had a true diagnosis, but nobody told them about their diagnosis. So again, they've been walking around for months, years, not realizing it until maybe another doctor had said, oh, well, by the way, because you have kidney disease, we need to do XYZ. And they're like, what are you talking about? I don't have kidney disease. Nobody talked to me about that. And so then, yeah, they just are slammed with this diagnosis. It's don't worry about it. We'll just wait and see. And then they run and hop on Google. Right. And so they're hopping on, like, I have CKD stage 3. What can I eat? And so what Google will produce is typically outdated nutrition advice from well over 20 years ago. I mean, this was information when I was coming out as a baby dietitian in like 2003, right? And it's still being perpetuated like out here on these internet streets. And it's just so funny because so much has advanced since then. So people have this lived experience where they are scared. They truly don't know what to eat. They they read things online saying, I have to stay away from bananas or avocados or tomatoes, and they are terrified to eat them because they truly feel like, oh my God, this one bite, if I take a bite of this, it's going to send my kidneys into failure. Right. But what people don't know, and I wish they knew more, is these foods aren't the cause of your kidney progression or your kidney failure, right? These foods are old guidelines to help somebody that's on dialysis to manage symptoms of, end stage renal disease because you're relying on a machine to clean your blood either every other day or 3 days a week, or you do home dialysis where it's through your belly every day. So more people need to know there is some strategy involved with your nutrition to help better support your kidneys and to really help slow down and preserve kidneys. But instead, everyone's on that bandwagon where I need to restrict, I need to avoid. I feel very limited in my food choices. I feel afraid that I can't eat. I'm upset that I can't eat. You're telling me I can't do this, I can't do that, I can't do this. And providers don't have that empathy working with patients and clients about your culture. If someone's going to tell me, like, my parents are from Trinidad, I grew up on Trinidadian food, and a big staple of ours is kalaloo. Kalaloo is cooked down. There's different varieties, but my mom would make it with cooked down spinach and kale and okra and coconut milk. You ain't about to tell me I can't eat that. Okay, because that is part of my culture. So you mean to yeah, because I can't have it because it contains a potassium food, I have to sit there and just eat white rice and stewed chicken while everyone else gets to enjoy? Like, no. So I think working with somebody, looking at somebody's labs, really basing your nutrition on how your labs are appearing. Most people that are CKD do not need to really be on heavy restrictions as you think, but it does help getting support from a dietitian so you can see and understand what the portions mean, how much of whatever nutrient is in the portions, and then it helps you feel more comfortable and confident with your food choices moving forward. You get more variety. But instead, people are unknowingly putting themselves in this like restrictive jail because a doctor gives you a handout and you're just expected to follow it. But like, okay, I'm following it, but I'm not really seeing much changes in or okay, my labs changed. Like, what does that mean? Can I incorporate something else? So there's a lot of anxiety. There's a lot of just that the food fear, and it's very prevalent. So by the time somebody comes to me or slides into my DMs or we're working together, it's having to kind of break that mindset and helping them feel more comfortable incorporating these foods and just explaining to them that these foods are actually very kidney supportive and helps with like slowing down CKD progression. So I just wish more people knew that, which is why I'm out here on these internet streets to kind of like fight the noise at what you hear.
This is such good information. I'm so glad that you're bringing awareness to this because I'm blown away.
Well, I agree. I heard like so much of information right now, which even I didn't know. First off, I was very surprised when you said that um like the providers don't even tell you that, your kidney is not in a great condition. They just see it and they think that it's fine and then they don't bring it up until you actually get into progression and then it comes as a shock to you. First off, I kind of want to ask some more questions around that. Like, how do you a little bit about your labs. Like, obviously, none of us are medical practitioners, but if our medical practitioners are not going to look at our labs and tell us where we are going wrong, I think it's important that we ourselves know that information. So, what would you say would be the danger zone that you need to read into? I'm saying the danger zone to make it sound like that, but what's the number that you would look at to be like, okay, I need to be careful now?
Yeah. So, yeah, I think it's more so I want people's, like, ears to go up. Do you know what I mean? Like, "Oh, this could be something that I need to maybe keep an eye on." Again, like, 'cause so GFR stands for glomerular filtration rate, okay? And that's an estimated measurement of kidney function. So I always see it as, like, if you look at that number, you can find it on most people, when you get labs drawn, you get, like, a yearly panel, which is either called the basic metabolic panel or the comprehensive metabolic panel. And on there, it's going to measure kidney function, your electrolytes, your liver function, all the things, right? So we need more diagnostic testing, to really determine if you truly have like kidney disease. But just looking at the number, and if you are concerned, and then just having that discussion with your doctor for an additional follow up, I think is key, right? So if I'm looking at that GFR, again, the lab isn't going to flag it, meaning like a little red dot as abnormal until that level falls below 60. But if you get labs drawn and it's between a 60 and a 90, and like let's say it's 90 and it falls down to like 80, okay, at that time I might think maybe I was dehydrated. Dehydration can definitely influence your GFR and your creatinine. That's another marker of kidney function. So my ears might not go up yet, but I'll be like, okay, maybe I was dehydrated. Maybe I won't, worry about it so much, but it's something to keep in mind. But the next time I go back, and let's say it's like in between a 60 and a 70 or 72, I'll go be like, okay, I noticed that yes, the GFR number is like 60 and below, but it's sitting at 72. Your doctor will be like, oh no, it's fine. It's considered normal. But I want folks to know like a GFR greater than 90 is considered normal. A GFR between a 60 and a 90 consistently is considered stage 2 CKD, and most providers see that as normal. But if you notice that GFR is not quite 60, but it's in the 70s range, you have a history of either high blood pressure, diabetes, if you have a family history of like CKD, if you smoke, then these are risk factors that GFR could continue to potentially go down and then you being diagnosed with CKD. So that's another caveat when you're looking at that GFR number, just to have that conversation with your doctor. And they still might be like, "Oh, you're fine, don't worry about it." But it's your body and it's your kidneys, and if you don't have a family history of kidney disease, I think it's a little maybe you feel a bit more comfortable, but it's still important to kinda watch that number because it could just all of a sudden drop in the 50s and you're just kind of like, "Whoa, what's going on here?"
I just want to say, when you said dehydration, I was like feeling guilty because Amanda's been telling me this for years. You gotta drink more water, you gotta drink more water. And I'm over here like, I don't drink enough. There's so many other, my daily, I've been like, okay, I gotta be more intentional. but I have not been consistent with it. So I'm actually hearing from a direct specialist now about how important it is to hydrate, and I need to make sure that I practice this because, girl, thank you.
I mean, I carry my water support bottle everywhere I go.
I
So
love it. She's out in the street with
I
her
make it
water
clear I'm
support
drinking my
bottle.
water. Yes.
Oh, Vanessa's here inspiring everyone to get a water bottle, a water support bottle. Honestly, from watching your content and following you, that's what happened to me because I only measure my water intake, not my food, but my water intake is measured every single day. So because I followed you and I was like, hydrate your kidneys. I am up to 2 bottles of these every day, plus additional liquids that you get from other foods. So I'm like, okay, I think I'm good. But I'm glad Lazina heard it from you because this is what I was telling you, Vanessa. When people hear it from me, they're like, okay. But when they hear it from you, I have to take this seriously. So you're a very positive experience for people to know that they need to hydrate their kidneys and their body more often. So I can imagine now if I was given that diagnosis, right, by a doctor saying that, hey, you've got CKD stage 3. And you said earlier that the first thing people do is jump on the internet and look up Google and look for a diet. And in all honesty, if that was me, I would do the same thing because now I'm terrified and I want a solution to the problem. And not everyone has the awareness, the knowledge, or even the financial capacity or capability to go and seek the kind of medical help they would require. So Google is like a very handy source. And now we have other things like AI. So why not just check how I can fix my kidneys? But that's obviously not something you should do, as you clearly stated earlier. It's better to seek some professional help because this is a chronic condition. It's not something you can mess around with. So from your experience, what is it that people get wrong about kidney health?
I mean, just the fact that they feel like if I just avoid these foods, right? If I just stick to this list, then my kidneys will be fine. Okay. And so they stick to this list, or the doctor just tells them, you don't need to worry about what you're eating. All you have to do is just drink more water and avoid salt. So then you go do that, right? And then let's say you come back and your labs are either the same or it's worse. I've had people say, my doctor just told me if I just lose weight, my kidney function will return. They've done that and their kidney function is still the same. So what people get wrong is they rely too much on these lists thinking that it's going to help their kidneys. And it does quite the opposite. It strips your diet from nutrients like magnesium, calcium, potassium. Yes, you still need potassium with kidney disease, and it strips your body of fiber. Fiber is super important for kidney health. It's super important for gut health. There's a big connection between gut health and kidney health. It's also helpful for like, heart health, all the things. When you are looking at these restrictions and these foods to stay away from, then the diet that you're on is actually more harmful for your kidneys in the long run. Because, for example, I was working with a client earlier this week. She was following the list, an old list that her doctor gave her. On the list, it told her to avoid carrots. So she goes on Google to read up more on it. And then she read, oh, if I boil the carrots and I can eat them. And I'm like, ma'am, I don't know where you got that information from because I have never heard that before, but you don't have to do that. So anyway, her diet was white rice, white pasta, chicken, and a small like salad of just romaine lettuce and like oil and vinegar dressing. That's all she ate because she felt like she couldn't have dairy, she couldn't have nuts, she couldn't have fruit, she couldn't have potatoes. And so when I tried to explain that to her, if I look at your diet, the first thing I see is where's your fiber? And then where are your nutrients? That diet that you're following based on these lists is actually causing more harm to your kidneys long term. This is more of an inflammatory diet. We want more of an anti-inflammatory diet. So I want to add back in those fruits and vegetables. And so that's one thing that people just, don't understand. And then some people want to fight me on social media. And I'm like, I'm going to die on this hill because I know just from my experience. Right. And then another thing is people feel like, my God, you can't have any potassium. So you can't eat these fruits and vegetables. And I'm like, I'm going to be the first one to tell you. Most people have a fiber deficiency because you're not eating enough fruits and vegetables. So the banana that you have, like a half a banana that you might have had 2 weeks ago, and then you have lab work drawn, and let's say your potassium is high, I'm telling you that banana from 2 weeks ago isn't the cause of the potassium being high. There's always like a non-diet related reason why somebody's potassium could be elevated. And that's where you do your research and your detective work and figure out the root cause. So another thing that people don't realize too is people are hyper focused on the potassium in the fruits and vegetables and the potatoes based on what you read. But then I talk to people and I'm like, there's potassium in animal food. There's more potassium in a 4-ounce portion of salmon than there is in a medium banana. But your doctor isn't telling you to avoid the salmon. They're telling you to avoid the banana. Do you know what I mean? So sometimes I'm like, make it make sense, but then at the same time, it's not their fault. It's not your fault. You are going based on zero information from your doctor, and then what little nutrition information that you do get from your doctor is just not, unfortunately, updated nutrition advice. And 3, a lot of providers don't refer out to a kidney dietitian because at they typically think like you don't need one right now. You're going to need one when you're on dialysis. Oh, you don't have to worry about that. You'll see one when you're on dialysis. But again, we don't want reactive healthcare. We want preventative healthcare. So I'm going to do what I can to help you in the earlier stages. The earlier, the better. Than wait until your GFR is at 10, and then you're running over help. How can I save my kidneys? I'm like, bro, you had all this time that was unfortunately wasted because nobody told you how beneficial nutrition was to really help slow down CKD progression. So that's one thing I wish people they don't get is that nutrition can truly help. It's not a end of, your kidney health journey. It starts right at the beginning of your diagnosis.
I find that similarly with psychology or therapy, there are so many resistances to go to therapy because you get labeled and maybe sometimes you don't feel heard. Sometimes a psychologist or a therapist who might be specialized in anxiety is not really going to be able to help someone who's been through trauma. So then there's these different niches that we go into, but again, the information is so limited, and one might prescribe medication, the other might say you need more yoga practices or you need more experiential experiences in your lives. But you're absolutely right when it comes to not providers not referring patients to preventative health care. They do the in-house preventative health care, but it's not necessarily information that is unique to that person and what their experiences are. So with all of that said, whenever it's time somebody needs to go to the doctor or they need to figure out what's going on with them, there's usually all of these things that they have to jump to. They got to call their insurance, they got to figure out what's covered, what's not covered. And it could be very time consuming. It could be very frustrating depending on the person's tolerance. And especially if they're good now seeking it, they're already upset about this diagnosis that they have. And when I say upset, I mean like it's emotionally affecting them. So, what is something that we can share with people to help them understand that, it's not something separate or maybe seek it first? Like what are to get out of the I need the doctor's diagnosis, but maybe I could take control of this beforehand.
Okay, so just with like nutrition, I feel like focusing on the biggest takeaway I want to tell folks is like really focusing on I want to add foods to your plates. I want you to have fruits. I want you to have veggies. I want you to incorporate nuts and seeds and whole grains. Having a more plant forward diet nutrition is very helpful with slowing down CKD progression. And so I understand where people has that hesitancy because they're just not sure. But again, that's where having open-ended questions with your provider to see like what is the health of my kidneys? What other ways that I can help support my kidneys outside of, medical management? Some providers might have some input and some might not. But if you may not have the means financially to work with a kidney dietitian one on one, then going to credible sources, finding credible sources out there. And there's a lot of us, like myself and other prominent kidney dietitians with like sound advice, nutrition updated advice, and following it that way. But I think the biggest takeaway is like for CKD, the minimum I would want somebody to consume is at least let's aim for at least 2 servings of a fruit, 3 servings of a veggie per day. That's the best place you can start. And if you are concerned about potassium because maybe of what you read, there's plenty of lower potassium fruits and veggies that you can incorporate. But I want you to still incorporate something, being mindful of like your protein portions, your animal protein portions, pairing your animal proteins with like a veggie or a fruit for this is a better way to support your meal and to support your kidneys versus just taking things away.
Yeah, I feel like there's so much misinformation, or not just misinformation, just not knowledge. Because like this is completely new to me. And everything that you're sharing, Amanda reinforces that with me because she's always trying to tell me to eat more veggies and pair my food better.
Yeah, and we're not here to gatekeep anything. And a lot of people get so much value from, like, just the free content I provide on my social media channels, and so, like, I don't know until somebody comes back and comments, like, "Hey, I listened to your advice and tips. My GFR went from, like, 53 all the way up to 64," and I'm just like, "Wow, like, that's amazing," you know what I mean? So, it's out there, but, I want people just to know those things, and so it's just, finding the right credible source and then, looking through that or finding a few that you trust and then using that information to benefit you. As, like your podcast title, no one's here to, no one's, I'm not here to save you. You have to, it's a CKD diagnosis. You're not cursed. You're not, God hates me and gave me this diagnosis kind of thing, but you have a diagnosis and it's in your power to do something about it instead of just sitting on the sidelines waiting for somebody to tell you, "Oh, you're fine. Let's wait and see." And then all of a sudden, it's that time. Let's go call to get a dialysis access place because you're probably going to need dialysis in 6 months. Like, no, I have health conditions. I'm not relying on my provider to tell me. I'm going to go do my due diligence to see what I can do from a holistic and a lifestyle change to help myself because no one's coming to save me. It's my responsibility. So it's up to you to find those credible sources and to apply that information on your own. People reach out for support because they want that support. You want help guiding you on your journey. And so that's where someone like me can help. But there's so many ways that we can provide that kind of help in either a group setting, a private setting, master classes, free content. You can take that information and run with it, but it's up to you to do that.
Yeah, and as you're sharing this, like we both come from the Caribbean and we have Caribbean relatives. I find that there can be a little bit of stubbornness when it
Here,
comes to learning about new information, especially the older generation. So, if you could directly speak to my mom, I just want her to know that there's a lot of diagnosis that she's getting, especially in her older years. So sometimes she'll tell me something's wrong with my kidney, and I can hear the fear that it's something bigger, but I don't necessarily see the diagnosis on her chart that would cause me to have concern. But she is concerned. So I want to share this message with her. What would you tell her?
tell her if you have a concern, then you need to follow up on that concern. Have that discussion with your provider. If you don't say anything, your doctor or your provider is just going to assume everything is fine. But I get really passionate about this because, like, I don't want people, like, please don't sit on the sidelines because you are concerned or you're scared to ask because it's your body, it's your health. Once you deteriorate to the point where you need dialysis, that's it. Like, there's no coming back from that. So starting now is really going to help you prevent, delay complications. So if you have a concern on your kidneys, really take inventory of what you are eating. If your diet lacks enough fruits, enough veggies, you're not incorporating like whole grains, then we need to talk about that. Okay. Like that doesn't mean that I can't have my roti. Yeah, I want you to have potatoes, girl. Like potatoes is a really good high alkaline root veggie to incorporate in your diet. And I want you to keep all that stuff. But we got to look at like what's on your plate. Like if your plate is half of like roti and potatoes, right? You get a little bit of like maybe some stewed chicken and the rest is white rice. I'm gonna be like, okay, how can I add a little veggie on that? Can I put some callaloo on top of that rice? Could I just make a little bit of like, give me a little side salad to make it a little bit more balanced? So, really taking that inventory of my diet and seeing if there's opportunities where I can add fruits and veggies. And that's a great small step, a small shift that she can make to better support kidney function.
Thank you very much.
I want to go back to what you said about the doctors, the providers, whatever you call it, right? And trust me, I get as angry as you do. You go to the doctor, and in India, it is not uncommon for people to start off with your weight. I mean, even medical practitioners, they will look you up and down and then judge, make assumptions about your health just based on your weight. And a lot of doctors, I respect what they do for patients and the medical advice they provide, but I'm not happy with the nutrition advice they give. And for better or for worse, they just do 1 year of nutrition in school, I think. And then they think that they have fully fledged credentials to give nutrition advice to people. And the advice is the same thing. If you say, oh, this person gained weight, I want to lose weight. And then they'll tell you exactly what to cut off. You already know what's coming. You know what food groups, everything. And that's already bad enough when you're trying to deal with weight loss. And then you're starting to get very agitated and upset over someone judging you, and then you get into some disordered eating. But when you said that this is happening even for people in CKD, I think that's terrible because this is a chronic condition which you have specifically said if they are put onto a dietitian early, you can prevent it. But they are literally saying, don't worry about that. You can just keep going. And then when you get to dialysis, because, you know, that's when, we'll give you a dietitian. That doesn't make any sense. Like, wouldn't you want your patients to live? So shouldn't you bring them in on earlier? And everything you shared about the food, I was like literally reliving this experience because this family friend of ours had CKD and he was, I think, at stage 3 or 4. But I still remember exactly what he would eat. He would have one type of fish, just okra, only pineapple. And this man was eating this day in and day out. And he used to be a foodie. So I'm a foodie. I understand what that would feel like if I was literally eating this every day of my life. I'm pretty sure he went into depression. But it was just ridiculous. If only I had known Vanessa back then, I would have like recommended someone like you because I know that you give tailored advice. You don't give the Google diet straight up. So you actually look at each patient and then you suggest what they should incorporate and what they can reduce. And I like that you use the word add. You didn't subtract anything from that lady's play. You're like, okay, what can I add to this? Because I always have that policy of what can you add? I feel like even telling someone in that state, what can you add? The way you approach it is really nice. And I appreciate that. But what I want to come back to is in one of your pieces of content, you said that CKD is not a food problem. Like it's mostly a management problem. So can you speak a little bit into that? Like what changes for someone when they stop trying to fix their kidneys or their CKD health and then they actually try to uh, relate to their CKD diagnosis a bit differently?
Yeah. So the CKD, like I said, it's not a food problem, right? It's more so of a management problem. Managing the CKD in a way where it's fully supporting and slowing down or, just helping better support your kidneys. And having ongoing support is really helpful for that. And it's not saying like, oh man, you need to be tied in and locked in with a dietitian for, here on out, but at least you can help to get that foundation of understanding what my labs are telling me, and you can get really good insight into what your labs are saying. I can read and interpret somebody's lab work to see where they're at and then where they're headed. And then based on that, looking at what they're eating, and then we can tailor, their diet or their meals. I hate the word diet. Tailor their meals to better support because I can see the gaps. And so if you are doing everything right, but you're not seeing that reflected in your labs, this is where that management can come in. Because providers, they're there to help with the medical management of the kidneys, not the nutritional management of the kidneys. So, like you shared, these one liner tips, nutrition tips, isn't helping anybody. But you can use the medical management of the kidneys along with nutrition management to better lock in that kidney support. And so that's just the missing piece. I don't care what anybody says, but all that on that hill. But that management of ongoing support. And then when your labs do change, what can I do now to, to shift my nutrition, my lifestyle, my blood pressure, blood sugars, if those are issues, to better support your kidneys moving forward. Because providers will just look at you and be like, okay, it's a number, but the number is stable. You're fine. You don't need to worry about those things. But I like to look at those trends. Those trends are important. And I want folks to understand, if you are like working with me in that kind of capacity, I want you to see where your trends are. I want you to look at, when you are looking at your lab work and you're seeing differences or fluctuations, that's a good indicator to have that discussion with your provider. It could be nothing. It could be hydration, but it could be something else going on that could be affecting your kidney function. So that's what I mean by management. And it's also because I do have people coming into my DMs telling me like, my GFR is this and my creatinine is this. Tell me what I can eat. And I can't do that. I legally cannot provide that. This is why you need to work in a coaching container, right? And I understand, because it's healthcare, people just assume I could come in and you just tell me what to do. But there is so much more nuance to somebody's kidney health than your GFR and your creatinine. It's your medical history, it's your medications, it's outside of just that panel. You're looking at your iron levels, hemoglobin levels, your thyroid. There's so many different labs that interact and play a role in your kidneys. And people don't understand that. Like, yes, your kidneys are part of your body, but it's the body works in a system, right? Your different organs can affect other organs. And so there's no difference with CKD. And so that's what I mean by having that management. Like, it's so much more than just the GFR and the creatinine. It's not so simple like, here's my labs, tell me what to do. And I'm like, I can't, first of all, that's medical nutrition therapy, and I cannot do that, and I will not do that. But if that's what you're wanting to do, that's a service that people like me can provide. And then when you help somebody better understand that, they could take those little nuggets that we've discussed and help themselves moving forward.
Yeah, that makes sense. And like you said, if people enter your DMs and ask you, you can't give them a quick tip because everyone's got a different stage where their kidneys are at. So that would not be legal or ethical, I imagine. But I want to address detoxes. What's your take on them? I think I told you I went to my pharmaceutical the other day and I saw them on the shelf. And I asked, do I need a prescription for this? He's like, no, you can just take them. But none of these are effective. Like, I don't think they're effective. Can you detox your kidneys? Can you detox your liver?
Your body has its own detox system, right? That's your liver and your kidneys. And yes, with CKD, it can be a little wonky. Can supplements help with filtering or helping to filtrate out a little better? Yes. Is detox the way? No. I have people that follow me on one particular social media account, and they go in and they have their own little conversations of these like remedies and these myths. And a lot of it is detox. But I'm also like, you detox your body, you are flushing everything out. What are you putting back in? Detox can cause dehydration, right? And so the first thing I'm thinking about is, your kidneys are not gonna like that, because after a while, you're dehydrated. That can negatively cause your GFR to go down, your creatinine to go up, and then your electrolytes are all over the place. That is not going to be helpful for your kidneys. So people come in there and they see like, if I just detox, everything is gonna be okay. I can flush out my kidney disease and cure myself. These are not cures. These are not remedies. I would rather you truly focus on getting enough water in your day, getting your fruits and your veggies and your healthy fats and your nuts and seeds consistently. We're not talking about perfection here. That better supports your kidneys long term than these supplements that you find on Amazon and in the stores. And I don't think I had this conversation with you. I was having it with somebody. The supplement industry is like, what, $1 billion industry? I mean, they really take whatever and they run with it, and people will flock to it because a lot of people, I feel like, are desperate for some kind of relief to help me in my situation. If I just take this, I will be fine. And so you have people that will take it and they swear by it. It's helped me. It's fine. I'm okay. But then months, maybe years go by. Guess what? That chronic disease is still there. Like, it's not going away. It's a progressive disease. So if you rely on a detox and you do nothing else with your diet and your lifestyle, it's not going to help your kidneys. It's not going to cure your kidneys. It's not going to reverse the damage. Like y'all, you do you, but I will not be the one to say that's a good idea.
I agree with that on so many levels though, because if when I think about the work that I do for myself, it's about mind, body, spirit alignment. And so whenever not emotionally taking care of something, then something else is gonna fall off. So if I'm depressed, it's gonna maybe show up in my shoulders, it's gonna show up in my eyelid. Nothing wrong with depression, but if I don't go to the source of what that depression is, then I am not taking full control of my body, my health, my emotional health, my physical health, my mental health. And that has such a strong component that goes together. If you don't really take care of yourself, you're just masking the problem. And so even with mental health, we try to go get medication, or we try to do like experiences, or try to do everything that avoids sitting with the problem and facing it to really look and see what's going on here. So I feel like that full circle comes back to the body, because I read the book The Body Keeps a Score, and while that is emotional, it is also based on our experiences too. I didn't have any knowledge about my physical health. Like Amanda will tell you this, my very first thing I said to her is that I can't eat carbs because it's going to go to my hips and my thighs and my chin. And that's an old Caribbean Indian belief. And so, how does that affect my eating habits now? Right? I'm not going to eat carbs. I'm going to restrict myself from eating carbs. But then when I do get the carbs, I'm going to sit there and stuff it down because that's what I grew up eating. So now I am causing this whole internal dysregulation with my thoughts, my feelings, and my desires. And that's coming out in my physical health. So I think that what we don't address, period, will manifest in our world, whether it's our physical, emotional, or mental space.
At the end of the thing, it's like you said, it's $1 billion industry and they want to make money. But you need to be smart enough and you need to take responsibility for your own body and make those decisions based on each individual. Like you said, to each his own. But at the end of the day, no one's coming to save you. You gotta take care of yourself and look after yourself. So, and I think it also ties into the guilt. They tie into the guilt. Like when I go to an alcohol store, there's always a counter of little bottles which have detoxes. And I'm thinking if people overdrink, they think they're gonna take this small little magical elixir and it's gonna fix everything. But I would rather than have more water, drink more water, even if that's not fully flushing out your system. I think that's way better than taking that because I don't really think it got much effect. But this has been so valuable, everything that I've heard so far. And we've talked so much about CKD, and I still have so many questions, but I know we have to limit our time. We'll probably have you back on another time. I think the last thing before we land the plane on our episode, I kind of want to ask, Lazina asked for a takeaway for people out there who might be struggling with CKD, but I want to ask for the opposite. What's one takeaway you can give to people like us who don't have CKD and we don't want to get there? So what's the biggest takeaway we can take from here?
So, biggest takeaway for folks that do not have CKD, but just want to have a better awareness just of their body, kidneys, and whatever. I would say my biggest takeaway is water is your friends. Water is your kidneys' friends. So, being consistent with your water intake. Again, we are never looking for perfection here, okay? But just being mindful of how much water you're consuming, being mindful of your plate, your what's on your plate. Again, we're not looking for perfection here. But is there an opportunity where I could add more fruit, veggies, whole grains, fiber into my day? Fiber is going to be it's impactful for everybody regardless of, CKD. Having more of these foods in your diet can really help with managing symptoms, brain fog, better gut health. If you are suffering from like constipation, adding these things back in can make you more regular. All of these affect our bodily systems, right? Another thing is getting in movements most days of the week. And it doesn't have to be, I got to go to the gym and lift weights. It could be simple as just being aware, going outside in grounds. I love putting my feet on grass. I like hugging a tree. I'm kind of woo. Like I like that kind of stuff, but I know it helps me spiritually, emotionally, mentally. Do you know what I mean? Going for a walk, yoga, journaling. These are all things that can help with alleviating stress. Stress is something that could be really harmful for your kidney health as well. And then another thing is making sure we're getting adequate sleep most days of the night too. Your body needs time to rest and digest. So if you're not getting enough sleep, that can definitely affect our bodies in general, but it can impact your kidney health as well.
Okay, I love it. I love all the information on this episode. It's so much to take in, but I know I'll be listening to it back. So I'll get to take in all this. But it's been so valuable.
I think for me, what I truly value the conversation, and Vanessa, your knowledge is incredible. I think it's always important for us to listen to other perspectives outside of ourselves. It's not something that is readily available or something that we go seek out unless it's really happening in our lives. So for anyone that's listening to this episode today, if this, this conversation made sense to you, head over to Vanessa's page. We'll have her following and where you can find her in our show notes as well. But I always like to say that if this resonates with you, or you feel called to, or you feel connected to it, take an action right away, because when we wait until tomorrow, then tomorrow becomes the next day and the next day. So this was a conversation that reminded me that the importance of following and being in integrity with what I want for myself. And so join our conversations, share this, encourage more people to learn about their kidneys. I highly encourage anyone that's on this episode, listening to this episode, to follow through with an action. And Vanessa, if you can just briefly share, how people can get in touch with you and what they can expect from you. If there's anything upcoming that they can expect from you, we'd love to close it out with a little bit of that.
Yeah. So you can find me on Instagram and on TikTok. So my DMs are always open. So if you want to reach out, message me there. My handle is the same for both. So it's at grain and green dot kidneys. And so I'm always out there on both platforms, but Instagram is really where I share a lot more insight and a lot more just like strategy. Just, you can learn more about me and who I am as a human because, social media can give you the illusion that everything is just lovely and perfect and rainbows all the time. But upcoming is I'll be launching my group program again. That's really beneficial for folks with stage 3 and stage 4 CKD, and so really giving the foundations of just, like, kidney nutrition and how to apply this to your own CKD journey because everyone's CKD journey is different. So you'll see me out here promoting that, and then I have various different services that I always, like, kinda talk about and share. So if you are ever interested, just slide into my DMs.
You heard her. She out here in the street. Her DMs are open, and she's prepared to die on hills that you're not willing to face. And so, including in our show notes, you're gonna have my lovely co-host Amanda's quiz for your food identity. But for me, it was incredible to learn about my night owlish behaviors. And then, of course, you have my quiz so that you can learn what your emotional needs are and what you need during conflict. On the screen here, you have three incredible women who are passionate about the things that we have learned about and really believe in. And so we just want to remind you that we are not here to fix you because you were never broken. We just want to be along with you for the ride and join our conversations, and we'll see you on the next.